Every year, millions of people navigate the world without sight. For most of us, a dental visit means reading a form, watching a hygienist tool come toward us, glancing at a screen showing our x rays. But what happens when a patient can't rely on any of that? How do you build trust with someone who can't see your face, your smile, or the instrument in your hand? Blindness and low vision bring a set of challenges to dental care that most providers are never really formally trained for, and small missteps, however well intentioned, can turn a routine visit into an uncomfortable one. Today, we're going to follow one patient's appointment to see exactly what that looks like and how it can be done right. This is Maria. She's 50 years old and she's arriving for a routine dental cleaning. 6 years ago, Maria lost her sight due to diabetic retinopathy, a complication of diabetes. Like many patients adjusting to vision loss, she's learned to navigate her daily life with confidence. But a dental visit full of unfamiliar sounds, tools, and touch still presents unique challenges. Let's see how her appointment unfolds. Unfortunately, appointments like Maria's don't always go smoothly. It starts the moment she's brought back. Without a word, the hygienist reaches out and takes her arm to guide her. Maria flinches, and she has no idea anyone was even standing there. A simple, well meant gesture becomes startling because no one announced themselves first. A few minutes later, the hygienist asks about allergies, but directs the questions to Maria's daughter, not to Maria. It's a small moment, but it sends a message that Maria isn't seen as the one in charge of her own care. Then in the chair, the hygienist reaches for a suction tool and begins without any explanation. Maria flinches again, unsure what's happening or why. And at the end of the visit, she's handed a printed sheet of home care instructions she has no way of reading. There are other moments that might look small but feel big for the patient. When the hygienist steps out to grab the chart, he gestures toward the door and says, "I'll be right over there." To a sighted patient, that means something. To Maria, it means nothing. She has no idea if she's alone in the room or not. And later, when Maria reaches for her own water cup, the hygienist quickly takes it and hands it to her before she can find it herself. It's meant as help, but it's help she didn't ask for, and over time, that kind of assistance can feel less like care and more like being handled. Of course, there's no doubt that we are simply here to help the patient the best we can, but we also want to make sure the patient feels like a person rather than someone who needs the assistance. These are unfortunate realities many patients face who have disabilities or challenges that most don't present with. It leaves many health professionals not always sure how to best navigate the situation. Now let's rewind and see what this same appointment looks like when it's done well. This time, the hygienist speaks before ever making contact. "Hi, Maria. I'm going to be your hygienist today. I'm right in front of you. Would you like me to hold your arm as we walk back?" A voice first, a choice offered, and suddenly the same gesture feels completely different. When it's time to ask about allergies, the question goes straight to Maria. Her daughter is welcome to be a part of the conversation, but only if Maria wants that. She's the one answering for herself. Now, being in the dental chair, the hygienist orients her to the space, and the hygienist will state, "The chair's right in front of you. I'll guide your hand to the armrest, and I'm going to recline it slowly now." A few extra seconds of description, and Maria knows exactly what to expect. Before any instrument touches her mouth, it's described first. "I'm going to check your gums with a small mirror. You'll feel a cool, smooth tip on your cheek. Let me know if you need a break." No surprise, no flinching. And at the end, instead of just handing over a printed sheet, the hygienist offers a choice. "I have this in large print, or I'm happy to just walk through it with you now, whichever you prefer." When the hygienist needs to step out, he says so clearly, "I'm going to step out for just a moment to grab your chart. I'll knock before I come back in." A specific statement, not a gesture, tells Maria exactly what to expect. And when Maria reaches for her water cup, the hygienist waits, then simply asks, "Do you need a hand with that, or have you got it?" Maria finds it herself. Offering help as a choice rather than taking over is now seen as a form of respect. That same approach carries through the entire cleaning. Every transition is announced. "Moving to the upper right now." The hygienist checks in along the way as well with the patient. "How are you doing so far?" Every sensation is described before it happens. You'll feel some light vibration and taste a bit of mint. That's the polish. And even the smallest movements come with warning. "We're all done. I'm going to raise the chair now slowly." All these verbal cues make a bigger difference than one can imagine. In a place that isn't visited so frequently by the patient, we become their eyes. With proper guidance, we can help them feel more comfortable and safe. The second the patient enters the room, it falls upon us to provide the exceptional care patients require, especially those with disabilities or challenges. None of this required special equipment, extra time, or advanced training. It required a voice before a touch, a question asked directly, and a description before a sensation. For Maria and for millions of patients navigating care without sight, that's the difference between a visit they dread and one they feel genuinely seen.